for many people and to a slightly lesser extent for others. Joining us live right now, Dr. Bahman Guyuron, who has pioneered this treatment in the city of Cleveland, and my wife Jody, a very private person who has agreed to be part of this story only because it is capable of bringing pain relief to so many others through the power of the medium right now anyway. And Jody, first of all, I know you suffered 4 migraines a week for nearly 30 years. A lot of people can't even relate to that. And you had this surgery 6 months ago. First, for those who don't know what it's like to have chronic migraines, tell us.
Oh, well, my migraines varied from controllable through drugs to really viciously debilitating, and after one of those I would feel as if I were coming back from Mars. I think they varied in causality and symptomatology, and they often do.
Mm-hmm. Now that you're cured, are these migraines gone, in fact?
Almost completely.
And quickly, how did you used to deal with migraines when you had them for those nearly 3 decades, 4 a week? I can't even conceive of that.
Well, I had a business, so I had to function. And I listened to all and read all the current medical literature, and I tried everything. I tried everything for 3 decades. I eventually learned to recognize early warning symptoms and treat them immediately with what was virtually a battalion of prescription drugs with varying degrees of success. Sometimes they didn't work at all.
Mm-hmm. Dr. Guyuron, if we could talk to you for a minute. Our report coming up tonight at 11 o'clock will explain in greater detail. In fact, we're going to explain it in total detail as much as we can, your relatively new procedure here that so few people know about. But for right now, how are your patients reacting to this surgery?
Ted, I can't even begin to describe to you the fulfillment and satisfaction that I get from the patients telling me one after other that we have changed their lives. I owe it to my team, people that work with me, but this has been a tremendous development, and I am extremely gratified with what we have been able to do for these patients.
Now, I've met quite a few of your patients and interviewed them, and I'll have their stories coming up tonight too. But in a few more words, if you can, Dr. Guyuron, how much can a procedure like this, in fact, change a person's life from day to day?
I had no understanding, or no, at least not enough clear understanding of what these patients go through. And I have learned to respect this condition and respect the patients that have been suffering from this condition for such a long time. Essentially, they can't plan their life. They can't do much. They don't know when it's going to come. And since we have been able to do these operations, they can do the things that they never did. They never participated in weddings and activities that are essential to their life. And I'm absolutely delighted with what these patients are telling me now, that they can actually plan their lives.
Mm-hmm. Dr. Guyuron and Jody, of course, thank you both for joining us.
Thank you very much.
Our report on this amazing cure for migraines will air later tonight at 11 o'clock here on News Channel 5. And again, thank you both for joining us.
Thanks, Ted.
Wow. You're welcome.
It's nice of Jody to talk about this, because I know she's such a private person, and
yeah.
You've known her for a very long time, obviously, and knew her when she was going through all these migraines, and you've expressed to me that you cannot get over the difference this has made for her.
No, first of all, I think when people suffer from chronic migraines, they learn to really face up to the fact that they have to function in everyday life.
Right.
And they can't allow the word that they're sick with migraines spread to too many people. So she's found a way to deal with it, as many people have, but now that they're gone, it's like the weight of the world being lifted off of a person's shoulders. I can try to relate to it, but I can't really put myself in her shoes.
People who have migraines can imagine this best. So don't miss Ted's story. He'll tell you all about this procedure, which is really groundbreaking and will hopefully become available to more and more people.
Thanks.
Such a help.
Tonight at 11.